Every day, 27 Canadians will die from colon cancer. Many of these tragic losses could be avoided if we accurately identified colon cancer spread. Treatment decisions and accurate cancer staging are based on finding at least 12 small lymph nodes and surgically removed cancer tissues. Currently, pathology staff search for lymph nodes in these samples by hand, remove them, and then submit them for further cancer staging tests. Unfortunately, this manual method of finding lymph nodes is unreliable and time-consuming. This results in 30% of Canadian hospitals and over 60% of American hospitals failing to achieve the 12-node standard. My name is Dr. Biswas, and my team at PathLogix have listened to the pain points of pathology staff across Canada and Europe. And based on their feedback, we've created an automated benchtop solution that scans surgically removed cancer tissues and determines the locations of all lymph nodes. Our solution greatly reduces pathology and hospital costs by over $50,000 per year, provides confidence to pathology staff that all lymph nodes have been collected, and most importantly, allows patients to receive more accurate cancer staging. Given the limited competition in the space, a scarcity of pathology labor, and rising cancer cases, hospitals would see an attractive payback ratio of less than 2 years on our device. We have also identified a $558 million annual global opportunity for automation of this process specifically. In summary, our interdisciplinary team will save healthcare expenditure, alleviate labor issues in this pathology workflow, and ultimately better inform treatment strategies for better patient outcomes. As a tribute to my aunt and millions of others who have lost their lives to cancer, our mission is to help patients get the best quality cancer care. And here at PathLogix, we're ready to fight for cancer patients, one lymph node at a time. Thank you.